Welcome to Aging Insights. I'm Melissa Chalker, Program Manager at the New Jersey Foundation for Aging. Aging Insights is produced by the New Jersey Foundation for Aging to provide information and resources to boomers, seniors, and caregivers. Today we are going to talk about the best-kept secrets in elder care. We are joined by Paula Span, author, blogger, and journalist, as well as Helen Hunter, geriatric social worker consultant, trainer, and spiritual director. They will talk to us about navigating services for older adults and provide some information about programs and services you may not know about. Thank you both for being here today. We're really glad that you're able to join us and share some of your secrets and tips with us. Paula, can you tell our audience a little bit about yourself and how you got involved with elder services?
Sure. I didn't come into this really as a caregiver, though I am a caregiver for my father, who's now 89. But for the most part, I came into it as a reporter. I was at the Washington Post writing stories about assisted living, which was a fairly new concept at the time, and about home care agencies. And I became more knowledgeable and thought it was worth exploring, so I wrote a book called When the Time Comes, and eventually found my way to the New York Times, which has a blog called New Old Age that's aimed at caregivers. So I'm not really a professional. I don't have any initials after my name. I'm a reporter.
Certainly, being a reporter and a journalist does have some credentials that come with it. And so we're glad that you're able to share what you've learned in this process with us. Right. Can you tell our audience a little bit, for maybe some people that aren't familiar with blogs or how that works, a little bit more about what the New Old Age is?
It's just a website it's part of a website. It's part of the NewYorkTimes.com website. And there are lots of blogs about all kinds of subjects on the Times website. But this one is aimed primarily at the adult children who are caring for their parents and their aging relatives. And we call it the New Old Age because it's not like it used to be. It's a different territory. So even though families throughout history have cared for their elders, it's different now in terms of how long people live and how complicated their medical care is, and how the people who used to take care of older people, namely women, are working, and it all becomes immeasurably more complicated, and we felt people could use a place to both vent about it and to exchange information and learn what was going on. And
so you're just one of several contributors that work with the New Old Age blog?
I do much of it, but there are other people, yes.
Right. Great. And so what are maybe some recent topics that have come up and maybe some interesting posts that have been on the New Old Age?
Well, we try to have new content almost every day or every other day. So there's a lot of information, and you can also search the site to see what have we said about this in the past. But we talk about really all kinds of health issues, all the new medical research, which there is tons of, driving, home care, the use of music, and all the interpersonal stuff. Is it ever okay to tell a white lie to your parent? What do you do if your parent was abusive to you when you were a child and now you're responsible for this person that she's elderly and frail? I've thought when I started working on this blog 3 years ago, I wondered how long it would be before I ran out of material, but it is not a problem.
That's great. So it sounds like people can really get a variety of information and stories at the New Old Age.
Well, the best part of the blog really is I'm just the springboard, and then 50 people come on with their comments, and all the comments are moderated, so it's not a crazy place like some internet zones can be.
Right. So so someone knows then if they read a post and then read the comments below it, that most of the things there have been read over and
an editor reads every comment before putting it up, and so there's no name calling. But people have had a vast variety of experiences with this in their own families, and so for them to be able to say, this worked for me, I don't agree, have you tried this? It's a nice conversation.
Yeah, and I think that's really great. One of the really great things about blogs and the internet as a resource is that it really can start a conversation so that people can learn from each other, which kind of is a great segue into your book, because your book is based on stories, is that right?
I had the same idea there, is that there are a lot of existing manuals of how-to books, and I have a lot of useful information, I think, in this book, but mostly I went into it following people through their experience. Let's start at the point at which your parent needs more help, and how do you negotiate that? Do you try to keep this person at home? Do you think this person needs home care? Do you think this person needs an assisted living situation? Should you move your parent into your house? Is this person so ill that she really needs round-the-clock nursing care? There's only one place to get that unless you're very wealthy. is at the end of life, what happens when you call hospice. So if you follow these, and these are all real people with real names.
Right, so could you tell us again the name of the book? And
it's called When the Time Comes, and it's published by Hachette. It's available through Amazon and in every through any bookstore. But I followed these people for, in some cases, a year or two. So there was the woman who was trying to keep her mother in her house. That was what was important to her, was to stay in her house, the only house she'd ever had in the Bronx. So her daughter had to hire home aides, and the central question was, could she keep hiring people as fast as her mother was firing them, because she felt she really didn't need help. So I think surely the daughter in this story went through 8 people in a few months, but finally found the person who was then there with her mother for 2 years. And her mother did die at home as she had wanted to. And so to me, that's a happy ending. Then on the assisted living front, there are 2 people in this chapter. One person decides to move in, one person decides not to. Moving a parent into your own house can be very stressful. In this case, the daughter was in therapy for herself, just saying, I need to not go crazy, having my mother in my house. But her mother's still there, so the individual way people work this out, because there is no overall solution. It's always your decision based on your own family and your dynamics and your financial situation and so forth.
Because everyone's situation is going to be different, but at the same time, when people read the book, they can maybe relate, oh, you know what, I'm not the only one that went through that, as well as get some ideas and tips as to how it might help them navigate a situation if they've just begun their journey with an aging parent.
I refer to it as a support group in print.
That's a great
But there is also a resource list at the end that will steer you to other places to go for
providing people with concrete information on how to access those services. That's great. So from your point of view in doing the book, are there tips or secrets that you've learned that you would use yourself or that you would recommend if people asked you?
Well, I think there are just some things that are overlooked, because there is a lot of help with elder care around, but it's fragmented and it's hard to know how to access it, and it's different in every state and every county. But I think people do overlook something called, well, first of all, they overlook a new profession called Geriatric Care Managers, which Helen is an example of, and she'll talk to you more about that. But I find that a lot of people don't know there is such a thing as a social worker who will work for you, not the hospital, not the nursing home, work for the family and help you come up with a plan and figure out what to do. I find also that people don't know about adult day programs, and New Jersey has been a leader in having adult day programs where if people are working and your parent wants to remain in his or her home, but you worry about her being there alone all day. There's not enough social stimulation. There's no one checking up on her. Maybe you're worried about, is she eating well? So it's the idea that a van can come and pick up your parent and take her to a center where there are a lot of activities, and there's usually a nurse on the premises checking people's blood pressure, checking their blood sugar, a hot meal, socialization, which is very important for all of us, including old people, and then take her home. Again, at the end of the day, she gets to stay home, but she's not there alone with the television all day long. And in New Jersey, there are also a lot of different programs, despite budget cuts, to help people with the expense. So I find that people just don't know about this, and they feel like if something's going wrong, the next stop is a nursing home, but it doesn't have to be. And then my final pitch, I make this pitch all the time, is hospice, because when people reach the end of life, enormously stressful for the family, a lot of emotion. Most people haven't gone through this before, and hospice are the specialists in end-of-life care, just like a cardiologist is a specialist in heart disease. And people are reluctant to call, and they don't call in time. So by now, 40% of all the people who die in the United States die under hospice care, but the average length of stay is like a few days. And so I'm constantly on the phone with friends saying, you know, my mother's failing. I say, call hospice. It's not time yet. Yes, it is. Call them now.
I think
they can do so much for you. They'll send nurses, they'll send social workers, they'll send a chaplain, they'll send home care aides, they'll help you. You don't have to go through this by yourself.
I think there's a misconception, as you say, that you have to wait till the very end to utilize a service like hospice, and you don't. So it's great that you're able to share that information with people. And certainly talking about our own mortality is something that's very difficult in our society. And so in working with families and doing the blog as well as your book, have you seen any ways that families have dealt with it? Any tips you could give the audience on how to address it with someone who maybe is not comfortable with talking about their death?
Well, no one is, but my mother died in hospice care, and it was an enormous blessing for the family, because you don't know what to do. You don't know how to evaluate things. You don't know who to call in the middle of the night. Do you call 911? Well, then, you know, someone's going to go to an emergency room and go through all of this. I think, you know, bringing hospice in is a way to have that conversation, too. To say, we're not going to stop taking care of you, but we're going to have a different goal. And the goal is to keep you comfortable and make the quality of your remaining life as good as it can be, give you time to spend with all of us, instead of racing around to various doctors who really can't make you well, but they can make you miserable. So just having that discussion. Sometimes it comes up around things like the documentation, a healthcare proxy, or a power of attorney. We need to talk about this. Who do you want to make decisions for you if you can't make them for yourself? But I think, you know, hospice does have social workers, and they are trained, and chaplains are trained to have the tough conversations. Right.
So it's great to use them as a resource as well.
I think so, yeah.
Well, thank you, Paula. I think that this conversation has been very enlightening, and I'm sure that our audience will enjoy hearing what you've had to say, and hopefully they'll be able to look you up on the internet and find out some of the other things that you've done.
Thanks.
And so, since you've referenced geriatric care managers, I will move on then to our second guest, Helen Hunter, who has graciously decided to join us today. Thank you, Helen, for doing that. And so, segue then from that conversation with Paula in dealing with what it is that geriatric care managers are. But before we get into that, if you could also describe to our audience who you are and how you came into the world of aging services.
Well, I am a social worker. I have a master's in social work, and I actually grew up in a household with 3 generations, and the experience of living with my grandparents from an early age prompted me to follow a career in geriatric social work. And I've been doing that for a number of years now, and I just love the field, and I've worked in hospice care, I've worked in home care, I've worked privately, and I feel that as the aging population grows, there's more and more need for professionals out there to help navigate families and clients into what's the next step.
Absolutely. And I think we've learned a lot of that from our conversation thus far, and so it's great that you can come join us today and add a little bit more to that. For the people at home who might not know, and this might be the first time they're hearing that phrase, can you tell us what a geriatric care manager is and what some of the things may be that they would help a family with?
Well, a geriatric care manager is usually a social worker or a nurse, somebody who is trained in the field of geriatric care, who will visit a client or family if they get a call from somebody that they're worried about safety issues, if they're worried about whether the person can live alone, and if there's a need for services. And the manager will come into the home and do an assessment, find out, are there services that can come into the home to keep that person living at home? Are there things that we can put in place? Or do we need to make decisions like moving in with family or possibly looking into assisted living care? But basically to work with the family and the client to see what is the next step and where do we go from here.
So it sounds like, to simplify that, and hopefully not too much so, but it's really someone who's there to kind of direct you to services that are available based on the person's need or the family's need.
Right.
And you know, this person should be knowledgeable about what services are available in that area and how to link them up with those services. And so how would someone find a geriatric care manager?
Well, there is a national website. It's the National Association of Private Geriatric Care Managers. They're located out of Tucson, Arizona, and they have a directory of people through each state who can be called, who are trained and who are under their auspices. And that's really the first place that people can go to. Also, the different area agencies on aging in the state have a list of geriatric care managers. in each state. And I get a number of calls from people who live out of state who have gone to these websites and have found this is where my mom lives, this is a person in that area, and they'll call from California or from different areas of the country saying, can you go to my mom's home in New Jersey and see what's going on.
Great. So, you know, obviously there are various ways to find it, and it's great that people can link up from wherever they are to find a geriatric care manager. You've referenced a couple times now that they should be trained. Is there a specific training or a certification that a geriatric care manager needs in order to do that job?
Usually a geriatric care manager is a licensed social worker or a licensed nurse. There is also, through the National Association of Private Geriatric Care Managers, a number of certification programs, tests that people can take to further their education. And if there are people who are certified in a specific area of care management, that can carry a more credential and more weight for a person rather than just calling and saying, I need somebody to go out. Having somebody who is professionally trained and who's gone through school and has that background is very, very important.
Sure. And so you've given us an example of some of the things that a geriatric care manager might do and how you can get involved with one. Can you give us maybe a story or an example of something, a way that you've helped a family that might be a typical scenario?
Well, I recently had a client's wife call in New Jersey, and a gentleman who had Parkinson's disease but was having a lot of problems with behavior, and she was the main caregiver, didn't have any other family around, no children, and was really getting stressed with the demands of daily caregiving and needed to know what services could be accessed to help her during the day and even in the evening, because she wasn't able to cope with that anymore. She wanted to keep him at home. She didn't want him to go to assisted living or to a nursing home. She wanted to keep him at home, but she just couldn't handle being there and caring for him 24/7 without help. So I went and visited and did an assessment, and we were able to get him to adult daycare for 5 days a week, and that was a blessing. And that gave her time to take care of herself and to be able to relax and have some respite. We also were able to arrange a few nights a week for a home health aide to come into the home and help the gentleman get ready for bed. And then in the few-hour period where he might be alone, we were also able to access a life alert system that he could wear around his neck. So if he needed help, if he fell, with Parkinson's, there was a tendency for people to fall. He could press the button and get help. So with all those services in place, just talked to her last week, things are going very well. So it averted a crisis for him having to go to assisted living.
Sure. So it really sounds like there are services out there that, you know, perhaps his family didn't know about, or that he didn't know about himself, that he could access, and by calling you in, they were able to get those services in place, and now can all rest easy that this gentleman is living in his home as he wants to be, but accessing services that allow him to do so safely and at the comfort of his family as well. So that's a really great example. Something we haven't covered yet with this is what does this service cost? Is this something that people would have to pay for out of pocket to access a geriatric care manager?
Usually it is a private pay cost. There are some states where they're trying to get Medicare to cover geriatric care management services, but that's not universal. In New Jersey, it is privately paid, and it varies on the area of the state, and it varies on the geriatric care manager. But there is a charge, and for a lot of geriatric care managers, they can negotiate the price depending on the client's availability to pay. Usually, though, when the family calls a geriatric care manager in, the family takes care of the cost.
Sure. So that's something that, as a caregiver, you might incur that cost yourself to assure that the person you're caring for is able to access services that you might not know about.
That's right.
Earlier, you referenced the area agencies on aging in New Jersey, which is something that we've talked about a number of times on this show in particular. And so if someone really could not afford or didn't have the resources, they could access the area agency on aging for similar help.
Right.
Great. It's very good to know. And not to focus completely on geriatric care management, are there other tips or things that you would like to share with the audience about navigating through the system of aging services?
Well, as Paula mentioned before, there's a lot of resources out there, and the internet is a wonderful tool to access, to find out specifically if there's a need for home health services or hospice services. You can really go and find a wealth of agencies that are available. You could call your church, you could call your neighbor who may have gone through this process before and may have a listing. There are lots of possibilities out there, and it's just to be your own best advocate and be the best advocate for your family member, because there are resources available. It's just a matter of finding them and accessing and being able to find out, okay, here is a great resource, and call and get things started. But there's a lot out there that can be accessed.
There certainly is, and I hope that our audience takes away from the conversation with both of you that don't be afraid to pick up the phone and reach out to your community, because as we've learned from talking to both of you, there is something to be learned from the story and experience of those around us, whether, like you said, if it's a family member, a friend, a neighbor, or even someone at your church who may have gone through something similar, and you can learn from their experience. And also the internet is a great resource, and there are a lot of things out there, but given that there are a lot of things out there that might not be correct or might not be the best resource, do you have any tips or suggestions for what people should look for on the internet in terms of maybe weeding out some things that aren't as legitimate as others?
Well, when you're looking for example, for a home health agency, make sure that they are licensed, bonded, insured, and make sure that the agency is, you want to make sure that they come in and make a visit and that you have a good vibe. I always tell people to trust their gut. If they come in and there's something not quite right, then you know not to go with that agency. If you're looking for assisted living, for example, and you go to make a tour of the building, when you walk in the building, you will know whether this is the right place for your loved one to be. You'll get that sense. And a lot of assisted livings will have a free lunch that you could go have lunch and you could take a tour of the building and you can see some of the residents and talk to the residents. And that would be a way for you to get a real feel as to whether this is the best place for your loved one. Some also offer weekend stays where the person can actually reside there for the weekend, and that way they could also know, is this really the best place for me? Do I feel comfortable there? Because you want your loved one to feel comfortable, whether it's with home care or whether it's with assisted living or whatever you have in a way of services. You want that person to be comfortable.
Right. So it's really, you know, from the point of starting the conversation till the point of accessing that service, you really want to make sure you take the time to, you know, not just go with the first thing that comes along, but really look at the things that are available and choose the right one for you. And
what I always do is I give people several agency names or several resources, and I say, I'm not going to rate one over the other, but it's up to you to visit or to have more than one come in and compare and shop around, because the first one might sound great, but then the second one may be even better and may have more tailored to what you're looking for. So definitely shop around and get a few reference points before you make a decision.
Great. Well, I want to thank you both again for joining us today. You've really shared a lot of great information and provided our audience with some great resources. Certainly the New Old Age blog and the accessing the Geriatric Care Manager national website is something that we'll share with our audience in the credits so that they can access that information and learn about some of the things that you've both talked about today. In closing, is there anything that either of you else would like to share in addition to what you've said?
Caregiving is so stressful that, and people outside it can almost not understand what you're going through. So there's a lot of literature showing that a caregiver support group is a really useful thing, even though you think, how can I add one more obligation to all the stuff I've already doing? This one is for you. This is where you can say the unsayable. This is where you can let your hair down, and you don't have to be the strong and brave one all the time. And if you can't get there, there are caregiver support groups that work on conference calls on the phone, and there are also some online. But one way or another, it's like what they tell you on an airplane. You have to put the oxygen mask over your own nose and breathe before you can help anybody else. And support is oxygen for caregivers.
Well, I think that's a great ending note to end on that, to remind people to take care of themselves, and certainly support groups, if that's right for the person, is a great way to go to get that support and oxygen, as you say, for themselves. So I thank you both again for joining us and taking the time out of your busy days to be with us here today. To read the blog New Old Age, visit the New York Times website. More can be learned about Paula Span at www.paulaspan.com. We want to remind you to find out about any services in your area, or for more information, please contact your county offices on aging or the Aging and Disabled Resource Connection by calling 1-877-222-3737. To find out more about the New Jersey Foundation for Aging and our work, visit our website at www.njfoundationforaging.org. We appreciate you joining us for this edition of Aging Insights. Until next time, take care, and remember, aging is everyone's business.